talking about their symptoms, and there's not a lot they can do for them.
Right.
And so it's very frustrating for the physician. So something like hypnosis, if you can use it, it actually is a great adjunct for the physician.
Absolutely, and it's true. And we always, my goal always is to work in a fashion complementary to people's treatments,
right.
not in a fashion antagonistic to their treatments.
Right.
So fibromyalgia, and from my observation, fibromyalgia is usually treated as a series of acute pains that the doctor is using medication to attempt to deal with. And that's understandable from the model, and I'm not criticising that. I'm just saying that usually that doesn't work for very long, or it doesn't work powerfully enough to give that relief. And so it's a miserable life of living with that chronic pain.
Right.
Or any chronic pain, fibromyalgia being an example. So that's the first thing. It's not in your head,
right.
And it's not something you're imagining.
Right.
It's real, and
right.
it's debilitating,
right.
for the people who suffer from it.
Yeah.
So.
And one of the things is that we talked about how chronic pain can develop and so forth, and some from an injury that the injury heals, but yet the pain, some form of the pain, is still there, versus something that fibromyalgia seems to come out of almost nowhere at times. Is hypnotism? Can you use hypnotism for both those kind of?
Yes, you can.
Etiologies is what they call it. In
yes,
business,
yes,
right? Yeah.
And I suppose what one is looking at is if and the first thing I want to be really clear, when people approach me with any sort of chronic pain condition, I want to ensure that they've had all the conventional medical work that needs to be done to ensure there is no pathology, there is no injury, there's nothing
right.
going on there.
Right.
I never want, hypnosis does not mask symptoms as a general rule. It won't do that.
Right.
But I generally do not want to work with somebody who's coming with chronic pain unless a doctor or several doctors have examined them and says to them, there's nothing that we can really, there's no cause that we can find, there's no organic cause,
right.
there's no pathological cause, we don't know why you're suffering this pain. And that's the person that I can best help. And from a practical viewpoint, if there's a simple physical remedy or a minor procedure which can relieve the pain, do it.
Why not?
Right. We're very practical.
Right.
It's not that hypnosis is the answer for everything. It can be the answer for certain things.
Right.
And so that's one of the things that I always want to ensure. Some hypnosis practitioners actually insist on a referral from a doctor for any condition of chronic pain.
Right. Yes, I know that.
And that's and again, that's probably a wise precaution. But I will say that almost everybody that comes to me, I can hardly think of a single example where this is not the case, has already been through almost every form of treatment, conventional and complementary, alternative, non-conventional as well.
Right.
They've tried acupuncture, they've tried manipulations, they've tried alternative therapies of various sorts, and they come and say, it's not working, or
right.
it brings me temporary relief, but it's very temporary.
Right, and that's not atypical, especially with something like fibromyalgia,
right.
Is that, they call it the patient journey. And when you look at some of these patient journeys, they go to their primary care physician first. He doesn't know what it is. And they cycle through different therapies, and they cycle through different doctors.
Right.
Everybody trying to figure out what's going on. I know a couple of years ago I saw some figures that the diagnosis of fibromyalgia actually took several years before, from the time they start complaining of symptoms, before somebody finally labeled it and said, well, I think you've got fibromyalgia. Right. So it's a long journey, and it's a very frustrating journey for
Absolutely.
patients. And like you say, though, usually when they come to a hypnosis practitioner, they've really exhausted a lot of things,
right.
which is actually good for us.
Yes.
Because then we know there's no true organic cause injury
right.
that needs to be addressed medically.
Right.
And that it's appropriate at that time.
Absolutely. And so what are we left with? What we're left with is an emotional cause. And again, I want to be very clear on this. That doesn't mean it's in your head. It doesn't
right.
mean you're just imagining it.
Right.
What it means from our standpoint is that there is something in your subconscious mind linked to an emotions, which are linked to a specific event normally, or an event, which has caused the growth and the seed of a series of emotions trapped inside, which is manifesting as pain.
Right.
So in the same way that acute pain is a signal from our system that something needs to be addressed, we need to stop doing something that's causing that pain or heal something where the injury has been caused. In the same way, that chronic pain, we can think of it as a message. It's a message from the subconscious mind saying, hey, there's something wrong. You need to address something.
Right.
Now, the reason from my model that the subconscious mind produces that is because it's already warned you, but you're not listening.
Right.
And when I mean not listening, I mean you don't know how to respond to feelings, emotions and sensations from the subconscious mind in an appropriate way.
Right.
And I compare it to a messenger. You know, if somebody knocked on the studio door and said, fire, right? And we said, no, I'm too busy, I'm doing this show. Right?
Right.
And we ignored them. Then probably maybe two people would come and knock on the door. And if we ignored them, maybe they'd come in and say, what's wrong with you people?
And people would be pounding on the door.
You've got to leave, get out.
Yes.
And then in the end, if we ignored all of that, somebody would come in, knock us on the head maybe, and carry us out, right, to save our lives. And that's analogous to what happens with the subconscious mind. It sends a series of warnings and messages in the form of discomfort, in the form of unhappiness perhaps, or another strong emotion, perhaps a minor pain or a minor injury. And if those are ignored, if we don't act upon them, it produces the pain, because it's saying, hey, if you're not going to pay attention to me, I'm going to make life really uncomfortable for you until you do.
And here's the funny part, that someone who's not familiar with hypnosis and how it works in the subconscious is that the subconscious is producing pain. The subconscious' primary goal or primary purpose is to protect you.
Right.
And it's a funny thing, but sometimes it will protect you by giving you pain.
Right, and isn't that what pain does to us anyway?
That's true, because
Right.
it's saying you need to do something to take care of a problem here.
Right, I mean, if I just, in a simple way, folks, you know, if I was to go and walk out and walk into a wall and bang my head, that tells me, well, you probably don't want to be doing that again.
Right.
But if I didn't have that pain, I'd keep doing it.
Right.
So there'd be no protection mechanism. Well, Bill, you're exactly right. You know, the subconscious mind is protecting us and trying to keep us safe by warning us that there's something there.
Right.
There's a problem, and it manifests as pain. There's something that hasn't been dealt with.
Right.
Now, here's the essential problem. It's subconscious.
Right.
It's beneath the level of consciousness, so we don't know what it is.
Right.
Right? Except through those messages. And how are most of us taught to deal with all feelings, emotions and sensations? We're either taught to ignore them, suppress them, distract ourselves from them, try and change them from one thing to another, but what we're not normally taught to do is how to specifically deal with them, and specifically what those messages are, what they mean.
Right.
And so we literally don't have the tools and the mechanism to deal with chronic pain from that standpoint.
Right.
So what do we do? What do people do? They turn to various methodologies to try and alleviate that pain. And what's the most common methodology they go towards is a methodology which dulls the whole system down so you don't feel it.
Right.
And of course, if it's dulling the feelings down and it's dulling the emotions down, and that's the process by which the subconscious is warning us that there's something wrong, what's the subconscious going to do? It's going to turn up the volume.
Right. Right.
And so a common experience that people describe to me is that I took some action to alleviate this chronic pain, maybe in the form of medication, sometimes an alternative therapy. And at first it worked, but now it doesn't. So they switched me onto a different drug, or I went for a different therapy, and that worked, and now it doesn't. Because the subconscious mind is going to find a way to warn you and keep warning you that there's something wrong. And so this becomes another source of frustration. So sometimes with people with, I think I literally had somebody with fibromyalgia, and I don't quite know what was going on, but she was on of various types for, I think it was 11 medications. And it wasn't just for pain. There were 3 or 4 for pain, but some were for depression and some were for anxiety.
Because of the comorbidities that you get with chronic pain.
Exactly.
Yes.
And then, of course, for other things. And she was almost completely numb to any experience at all, because that's the only tool that she had to deal with it.
So talk about now. We've talked about there's something down inside the subconscious that's creating this pain. It's giving you a message. So how do you use hypnosis then, basically, to get at that? What do you do with that issue, problem, emotion? What does it consist of?
Well, there are 2 basic paths, and I'm going to talk about both of them, but one I'm going to talk about a little bit more because it's my specialty.
Right.
So there's a great deal in hypnosis talked about pain management. Actually, there's a good deal in the medical world, talk about the management of disease.
Right.
We talk about management a lot because it's a more, you hardly hear anybody talk about cure anymore.
Right.
That's a dangerous word to use because if you don't cure somebody, you might get sued or somebody might tell you something. But we talk about managing illness, and consequently people talk about managing pain. Now, if we go back to our example of Dave Ellman and his father, the hypnosis practitioner quite properly in that instance used hypnosis to manage the extreme and terrible pains of the terminal stage of cancer.
Right.
And again, that's a legitimate use of hypnosis or any technique where there is an underlying organic cause. However, when there is a chronic cause, my goal and my objective is to try and find out why it's there. Because if we can deal with it at its root, the chronic pain goes away. Because if you've alleviated the cause, it goes away. Because as you said, one of the key things there with an acute pain is that after the healing has taken place, it goes away. You don't feel it anymore, right? That's the nature of it. And so my objective is to find out what the cause is.
Right.
So then the question becomes, what's the use of hypnosis in that cause? And that's where it becomes tricky.
Yeah, because you and I both know that there's a couple different forms that you can use. You can use a direct suggestion type of hypnosis, and you can actually numb a part of the body doing something like that. And you can use what we know as regression hypnosis to try to go down and get at the real cause of the problem, the real root of the problem.
So talking just briefly about the first one first, the direct suggestion one brings people into a hypnotic state, which again we'll demonstrate here and many times in the course of this show. Mm-hmm. And then at that point, sometimes one has a script or one might fire suggestions along the lines of this pain had a purpose once, but it no longer has a purpose now. You're entitled to a life free of pain and a life of comfort and ease and joy. And we carry on compounding and firing suggestions like that in the hope that we can overwhelm that subconscious idea that has caused the pain.
Right.
And sometimes that can work.
Right.
Unfortunately, very often it does not work. And the reason that does not work is because the subconscious is not going to be so easily overwhelmed. It's telling you something for a reason. And so in that instance, we use something alternative to that, and that's what we call healing hypnosis by regression to cause.
Right.
What does that mean? That means that we are trying that pain is a manifestation of a cause. Something has happened earlier on that's manifesting as that pain. Now sometimes it's something that's happened as a result of a specific procedure, sometimes a surgical procedure,
right.
or sometimes the procedure following an injury.
Right.
And there are Dave Ellman and others mention very, very specific causes of that.
Exactly, yeah. Yeah, I think one of the ones that really was enlightening for me is that I think it was a woman who had a chronic pain in her abdomen, chest, mm-hmm. somewhere in that area, and following, I think, gallbladder surgery.
Yes.
And the thing is that the surgery went fine. There was no issue. And what he did is he took her into hypnotic state and brought her back to that surgery, because most people don't know, but our subconscious is still aware during the surgery.
Yes.
You're anesthetized, but it's still recording what's going on. And he could ask her what the surgeons are saying.
Right.
And one of the surgeons made the offhand comment, well, she'll never be the same again.
Right.
And what he meant was that she will feel so great, and be, but he didn't say that.
Right.
And her subconscious took that to mean, oh, she's going to be in pain from now on.
Right.
She'll never be good again, that kind of a thing. And so her subconscious generated it. And as soon as he could correct that misunderstanding, the pain went away.
Now, this is a great example, and there's a few things that came from that. That was the first time, I believe, and that was sometime in the 1940s, where it was recognised that people in a state of chemical general anaesthesia could, in fact, hear conversations.
Right.
They couldn't necessarily recall them when they're brought out from that, but if you bring them into hypnosis and stimulate the subconscious mind, which is still recording because it's still protecting one at that moment,
right.
you can hear them. And in that particular instance, the content of that conversation was absolutely confirmed with the surgeons. That's exactly what they
Right.
said. So this isn't
Right.
something that the patient was imagining.
Was made up, right?
But a subconscious mind interpreted that in just the way you say, oh my goodness, that means I can never be well again. And that's the hypnosis. That's the selective thinking.
Right.
The selective
I will
thinking.
never be healthy again. I will
That's
never
right.
feel good again.
I will never be
Right.
a well woman anymore. And so once she understood the true meaning of that in hypnosis, there was no reason for the subconscious mind to send any messages anymore, and the pain immediately
goes away.
Right. Now, of course, before that was done, Elman that was referred to him by her doctors, who could find no cause
Right.
for that pain.
No physical cause.
And that particular instance where pain follows surgery, I hope I'm about to work with a young man. He's only 28 years old, I believe, and he might be 30. But he had an operation on his ankle 2 or 3 years ago, and this is a common scenario. He's still in pain. He doesn't know why. No surgeon can tell him why. None of the doctors can tell him why. There doesn't appear to be any reason why.
Right.
It's a good chance something's happened during that surgery,
During the surgery.
immediately before,
Right.
immediately afterwards. One of my clients currently sells heart valves, and what most people don't know is that the salesperson who sells those heart valves is right there in the surgery. They're very often telling the surgeon how to do something or
Right.
not to do something.
Right.
Don't be shocked, folks. Those both people really, really know.
They know
and
their
they're
business.
and
Yeah.
he's literally, every single day he is watching, literally every day, heart surgery.
Right.
So he's seen thousands of, and I ask him, what are people like before they go in? And he says, most people, there's a look of absolute terror and horror on their face.
Right.
Right? And so one of the things that I do is help prepare people emotionally for surgery and after surgery
Right.
to alleviate those, those possibilities. So
fears.
there's something where something can get into the subconscious mind. Now, the process is you regress them back in hypnosis to that
To that state.
to that cause,
time.
alleviate it,
Right.
and it goes.
And one thing, because just for viewers and stuff, because people might say, well, look, if I can't remember it, how can it be that my subconscious is still working, right?
Right.
But if you think about it, your subconscious records your long-term memory.
Right.
It's the seat of your emotions. It also handles your blood pressure, your heart rate. So the subconscious doesn't shut off, because if it did, your heart rate would stop.
Right.
And all that. All those physiological processes are still going on. So why wouldn't the memory part of it go on?
Absolutely.
You just can't access it, is the difference.
Absolutely, and that's a great example, and I'd like to further that example by saying, let's take another one. Your one's asleep in bed at night, and if you start to smell smoke, there's a good chance you're just going to wake up and respond to that.
Right.
Here's another really simple one. Unless we're blind drunk or under the influence of drugs, most of us just don't roll out of bed every night. We go to sleep, but we know where the edges of that bed are.
Right.
We know where it is. Otherwise, we literally find ourselves on the floor most
Right,
nights.
exactly.
Because we're not perfectly still. What's doing that? The subconscious mind. It still has a sense of spatial awareness. And I'm sure almost every mother, and probably quite a few fathers, maybe all of them, can recall that time when their children were very young, where they heard just the slightest cry or murmur, and they're right there. They're
up and out.
awakened even from a deep sleep.
Right.
So the subconscious mind is always there, and it's there during chemical anesthesia as
Right.
well,
Right.
even if you can't remember consciously.
Right, exactly. So one of the things, too, is that we've been talking about events that your conscious mind actually knows.
Right.
And as you and I both know, that a lot of times these chronic pains actually might have a source that we actually don't know.
Yes.
What the source is.
Absolutely.
And so if you talk about you bringing the patient back to that time, the
Right.
client in our case, back to that time,
Yes.
and you know it, that's easy. What about the case where it just comes out of nowhere,
Yep.
and they don't know? How do you know where to take them back to, and what is the process?
Well, I have a very simple rule of thumb. When people ask me, well, why do I have this problem? Why do I have this pain? My answer, which is almost invariably correct, is I don't know.
Right.
But your subconscious knows.
Right.
And if we use the right procedure, it will lead us to that. Now, what's the language of the subconscious mind? How does it communicate to us? How does it communicate with that client? Emotions. Connected with that feeling, sensation of pain, there will be a series of emotions, and they're not the same for everybody. They may be very deep emotions, Initially it might be sadness, it could be guilt, it could be all sorts of things, but we stimulate those emotions. I stimulate the emotions in the hypnotic sense.
Right.
And having stimulated those emotions, then we use those emotions to literally draw us back to the first time, scene and place, connected with those particular emotions and sensations, which are connected to the pain. Now, the interesting thing is that the subconscious mind, as far as we can tell, doesn't think the way the conscious mind does. It doesn't think like yesterday was yesterday and tomorrow's tomorrow and it's now 3 o'clock, it's going to be 4 o'clock. It doesn't seem to think like that at all. It seems to view the world as linked in an almost eternal present, but linked by feelings, emotions and sensations. And one can think of it almost like a spider's web, where the strand of one web of one emotion leads naturally to another. And so, if one brings somebody into a deep enough hypnotic state, it's possible to take one of those strands of the spider's web, as it were, and trace it back to its origin. And this is the interesting and the key thing. Normally, there is a specific event that is the seed cause of why that person is feeling the pain that they're feeling. It's not a general thing, it's literally a specific event.
Very specific event.
Very specific.
Right.
Now what's happened there? In the specific event, I don't know. It's different for every person. And these events themselves sometimes occur, and mostly occur, when people are very, very, very young. Sometime between conception and 2 or 3 years old, occasionally a little bit older than that.
Right.
Before the critical faculty, which is the gateway between the conscious and the subconscious in the hypnotic model that I use, is formed.
Right.
Something's gone in, something's been seeded, which gives them a certain connection to the world, which builds up a series of emotions, feelings and sensations, which become overwhelming to the system.
Right.
And they present themselves as pain.
Right, and one of the things we've talked about is that some event happens, usually very early in your life, and there is some emotion associated with that. And that emotion, fear, let's say, gets trapped back in that place.
Right.
And so the event and the emotion are linked together.
Right.
And so what we do in a regression is we bring you back through the spider web and then go in and release that emotion, because the problem really is caused by trapped emotions.
Right.
And so if we can get rid of that initial emotion, right, that's causing the problem, it's linked to all to events that have a similar emotion.
Yes.
So they may be years apart, they may be a completely different situation, but yet they may be all linked by fear, let's say.
Yes.
And once you relieve that initial pocket and empty that initial pocket of emotion, a lot of those other ones will clear out by themselves. Right. But it's really the combined emotions through that whole thread that's causing this extreme problem.
Absolutely.
Right?
And so, you know, this is good for us in many ways, because this is one of the enlightening things about this process, both from the standpoint of the practitioner and the client, which is this. You can actually feel and whether the process that we use for the alleviating the pain is working for you. Right. You don't have to guess. Fortunately, the pain itself provides a form of measurability. Right. And so, you know, one can see if relief is there and if it's present and how long it lasts for. Right. Through the process. So one doesn't have to guess at this. It's not an act of faith. And the surprising thing is one doesn't even have to believe in the process. That's the strange thing. People often say to me, well, I believe or I don't believe in hypnosis. And for me, that's a little bit like saying, well, I believe or I don't believe in gravity. Whether you believe it or not, it's going to operate. If you jump off a building, believe it, it's going to drop you to the floor, and if you don't, it's still going to drop you to the floor.
and that's the thing. That's the one thing is, you know, to emphasize really, is skepticism doesn't matter. Right. As long as you're willing to go with the process and follow simple instructions, right, you can do it. I know myself. I came to you initially for an issue, and as I was driving to your business, I was thinking. I knew I was going to do a regression, and I'm thinking, right, this guy's going to regress me back to a 3-year-old, and I thought that just is not going to happen. This is all just fantasy and stuff, and of course it did happen. Right. You know, and there was emotion trapped there, right, and it helped enormously to release those kind of emotions. Right. You know, the other thing I just want to point out to you, because people who think about doing a regression, a lot of times they're very concerned that they are going to find out some real huge trauma, like they've been sexually abused or
Yes.
something like that. And that's not necessarily true, and so forth. And even if you were, you don't go back through the same trauma, even if you go back to the time.
Exactly. It doesn't. You're not. This process, if conducted correctly,
Right.
does not re-traumatize anybody.
Right.
It doesn't work like that.
Right.
In fact, the subconscious won't even let you go to certain places if it feels like you're going to be damaged. It has to feel completely safe. You have to feel completely safe,
Right.
because its goal is to protect you. However, what you said was also very, very true, which is that sometimes the cause of something can be what appears to us very minor as an adult, but to the child was deeply, deeply significant and important.
Right.
And so these conditions are compounding emotions created by an initial impression formed when one was a little person, when one was a young child.
Right.
And of course, the way a baby, a 1-year-old, a 2-year-old, a 3-year-old, or a 4-year-old perceives the world from their level of understanding is completely different from the way we do
Right.
as adults. And so it's not as if every person's chronic pain is the result of physical abuse, sexual abuse, emotional abuse in the way that we think of it as adults. It may have been something quite minor. However, it's very real and it compounds over time. And funnily enough, the fact that it's very minor, that there's not some great dramatic cause, may mean that it's something that we partially remember, or we remember some of it but have reframed it as an adult,
Right.
and we don't give it any significance.
Right.
And so it builds and builds and builds over time.
Right.
So you're absolutely correct. It doesn't mean that everybody's going to discover they were the victim of some terrible sexual abuse. That's just not the way it works.
It's not the way it works. It can be something as simple as, geez, I was left as a baby in a wet diaper in a cold house,
Right.
and I was crying and crying, and my parents were busy and didn't realize or didn't get to it.
Right.
And it could be a trauma from that.
Absolutely.
And so, but again, it's not to be afraid of, even if it is something more major. You just don't go back to the same time and place. You're not that baby anymore.
Absolutely.
So you visit it back in your subconscious, but actually what you feel afterwards is relief.
Absolutely.
And
And
healing.
every session that we do with people, at the end of it, they're going to feel some level of relief almost invariably.
Right.
Now, so what we've done today is we've laid out the groundwork.
Right.
We've talked about acute pain, we've talked about chronic pain,
Right.
and we've talked about it in general terms. And I hope that people watching this have got a better idea of at least the beginnings of how hypnosis helps.
Right.
On the next show, what we're going to do is we're going to delve more deeply into specific conditions. I'm going to give examples of specific cases and things that we found.
For chronic pain next
For
time.
chronic pain.
Right.
We're
That
going to stay
sounds
on that
great.
subject.
Yep.
And then we're going to learn and discover more about how hypnosis really helps that and the actual real world results of people who chronic pains have been alleviated
Right.
as a result of the hypnotic process.
Yeah. And
So
it really does help a lot of people.
Oh,
So it's an amazing process. I've been through it myself, and it really helped.
yeah, and it's and our goal here is to make more people aware of that as a possibility,
Right.
where hypnosis is something that can really help them.
Great.
So that's it for this week. Thank you very much for watching this edition of Hypnosis Helps. We hope that the information here and the discussion between Bill and I has been useful to you. And thank you very much for tuning in. So it's goodbye from us.